Good evening, everybody. How you doing out there in social media land? All right. Well, it's another installment of Medical Talk in Layman's Terms with Nurse Charlene. And tonight's topic of my Back to the Basics is stroke, also known as CBA, also known as TIA. So I'm going to be explaining that tonight for anybody that's interested or not interested, but see me on here and stuff and want to check out what I'm doing. All right. So welcome on in. Y'all come on in and stuff. All my fellow nurses and doctors, future nurses and doctors and stuff, come on in and just hype me up and everything and stuff. That's how I get to teaching. I start teaching my little tail off as soon as I get a couple people in here and stuff, root me on and everything. But yes, definitely welcome on in. I wanted to put a little bit extra on the topic, which tonight is going to be stroke. It is a medical emergency. And because it's getting to the holidays and all the different things that are happening, okay, just getting a couple people online. All right, I got it on low. Sorry, and stuff, and then put me on. Okay, yes. Okay, so long story short, I'm Charlene, or Nurse Charlene, the host of Medical Talk in Layman's Terms with Nurse Charlene, and just want to get into the habit of coming on each week, and I try to pick topics that are near and dear to you because somebody has had a stroke and stuff. So tonight I'm gonna do it a little bit different and stuff because there I have a lot of statistics, and that means like the world news and stuff, and how many people having stroke in a certain area, a certain ethnicity group, or whatever it might be and stuff. And then I do a little after I do a few definitions and show you what stroke is, because it is medical talk in layman's terms, meaning explain it as simple as possible so that somebody that knows nothing about medical stuff will be able to kind of follow along. So, you might catch me using, instead of using urine or urination, I might use pee pee. Instead of using stool or a bowel movement, I might use poo poo, and stuff like that. Just simple things like that. All the nurses that might get on or follow along and everything, you know how it goes and everything. But in order to get people on and get them interested in stuff, I need to bring it down to layman's terms so that everybody gets something out of it. So I want to see if I could get my chats up, because I think I've seen somebody come on. Oh, yes, yes, yes. I'm going to put it back on here and stuff. So we got Miss Josie. Welcome on in. Thank you for coming on and rooting me, Josie. You are wonderful, and I do appreciate you and stuff. Definitely tonight I'll be talking about stroke and all the stuff, and that it is a medical emergency. So it's very serious. And welcome on in, Rosetta Granny Allen. That's my mommy. And she always comes on to root me on and everything. And also she is a walking miracle. And also had actually several strokes, but one big one. And yeah, that was really rough for us. But I just thank God that she's still alive and kicking and everything. So definitely I got so much for you guys in the future. I've been making a lot of plans. I got guest speakers. I even just recently was able to get a emergency room or ER physician that Dr. B said that she's gonna come on the podcast, and she has a book out about emergency medicine and the whole thing. And I'm gonna let her just have at it, and everything. She's a wealth of knowledge and everything. And I was able to do this, and we're going to start bringing these people on and stuff. I have somebody else that wants to do a guest segment and come on and talk about organics, real organics, the stuff, not just the fancy word or the high price food at your Safeway or whatever grocery store you're at and everything, but real organic supplements and everything. And then it's going to be so much to cover and everything. But around these holidays where we're having our turkey and gravy and what is it, greens and dressing and all these good things and stuff, you want to know what you're eating so that you don't just eat until you're overeating and everything and stuff. And then we got our diabetics out there. I'm supposed to get some food too. I'm hungry, and stuff like that. And then their blood sugar is 400 or 500 and they in the hospital with a stroke. Yeah, okay. So y'all catching on to what I'm doing and stuff, but it's so much that I want to offer you guys, and definitely this is the place and the avenue to do it. But before I get started and get all the way in here and stuff, I want to read my podcast disclaimers so that I can continue to give you the things you need and everything. So it goes as follows. Okay. So it goes as, the podcast is for informational and educational purposes only. Okay. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. Go to your doctor. Don't try to find it on social media or TV or something like that. Oh, welcome in, Tony, cousin Tony. Hey, thank you for coming on. I missed you and stuff. And so if you have questions about a medical condition, reach out to a qualified healthcare professional. Go to your doctor. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast. Not even mine. I'll be giving the good stuff, but not even mine. Okay. Guest views are their own and may not reflect the views of the host or this podcast. And then they may reflect my views. Okay. The information shared is for general knowledge. It should not be used for any legal or medical purposes. Meaning, I cannot help you with your lawsuit. But if you're doing it in good faith, I hope you win. Okay, I don't hate on it. All right. Always consult with a licensed professional who knows your medical history for a meaningful evaluation. They're not nosy. They need to know everything. Stay informed, guys, but always seek professional medical advice when it comes to your health. Get somebody with a license that's actually taking your insurance so that they can get paid, but they get paid for actually doing the work. Okay. All right, y'all. I'm going to be diving on in and stuff. And so tonight's subject is stroke. So prior to this, I talked about diabetes in my Back to the Basics segment. And I talked about diabetes, and then I talked about hypertension or high blood pressure. And I also talked about kidney disease and failure, kidney failure. I talked about sarcoidosis, which is mainly a lung. It's real serious when it's in the lungs, but it's like almost they mirror it with like a TB, tuberculosis, and everything. So it's real serious and everything, but that was a viewer's pick. But those are some of the things that I've went over the last I would say 4 weeks or something like that. And so tonight is stroke. But guess what stroke have something to do with? And I'll get to that soon and stuff. And that would be, stroke has everything to do with diabetes and everything to do with high cholesterol, which I haven't got to yet. Okay. And everything to do with high blood pressure, or technical jargon, hypertension, and stuff. So yes, and everything. So I'm just going to start off with some definitions. Y'all get y'all questions together and everything and come on in and stuff. You know how I love to get pumped up once you start asking questions. Okay, Rosie Granny Allen said, I'm here, Nurse Charlene. Let's go. Let's go. All right. Squabble up. Okay, let me see if I can make this bigger so I can see. Okay. It looks like I can see a little bit. Okay. So we're going to start with a stroke. A stroke, sometimes called a brain attack, like high blood pressure. You can have a heart attack. Well, stroke is a brain attack because guess what it attacks? Your brain. Okay. So, also called a brain attack, is a medical emergency that occurs when blood flow to an area of the brain is interrupted or reduced. When this happens, the brain cells are deprived of oxygen and nutrients that are in the blood, and it begins to die. So just like with the heart attack, that part of your body that part of your heart that is attacked, because it could be upper, lower, or anywhere on your heart, it can be attacked. And so when that happens, that part of your heart dies. So for a stroke, which we're talking about a stroke tonight and stuff, when that happens to you, that part of your brain that's affected, it dies. You could still live, even with a heart attack or a stroke and everything. It's just that part is never the same. That part is deprived of those nutrients. It has to constantly have those. Your heart has to constantly beat. So when that goes away and stuff, that's a problem. That's an absolute problem. Welcome on in, Miss Sandra. Is T with you? Oh, yes, she said, and T is here. Yes, welcome on in, ladies and stuff. Glad to have you on. Tonight's topic is stroke, also known as CVA, cerebral vascular accident, or TIA, transient ischemic attack and stuff, which is a mini stroke. I will be talking about that in a minute. I just started. Okay. So I just read the definition to what a stroke is. Now I'm going to tell you about, there's several types. I'm only going to talk about the three most common. There's a lot of different strokes and stuff. Some are right at birth. The baby can have a stroke, and stuff. So this is serious because the baby has a brain, so the baby could have a stroke too, or a kid, or, whatever it might be and stuff. So going on to the different types. One of the main and most common one, and I'm going to give you some statistics tonight and everything, it's ischemic stroke. And it is caused by a blood clot. A blood clot. So, okay, before I get started on the ischemic one, just my board behind me and stuff, just so that you know that I'll be up on it when I do a subject. I make sure that I make my little, my version of drawing and Picassoing things and everything. So on this side right here, I will be explaining that later on in the segment and everything, but it's called BFAST, BEFAST, and they stand for something. It's an acronym, just in case you don't know what that is. Each letter stands for something. This is how you would be able to diagnose a stroke on somebody just out on the street, not knowing anything about medical. But if you could remember these letters, BFAST, you might just save somebody's life that's having a stroke. On this side, before I get back to the comments and stuff, is a brain. It's a unisex, so it ain't a girl, it ain't a boy. It's somebody with a brain, just a human. That's all. I will put it's just a human and stuff. But it says I'm having a stroke and stuff, and then I put right there that's a little blood clot. We got a problem. Okay, and everything, and so that's what that is. So this little squiggly thing, no, it's not a flower. No, it's not an aloe vera plant or something like that, but it's actually blood vessels that feed the brain food and nutrients. When it gets cut off, that's how the brain dies. It needs oxygen, it needs nutrients, and all of this good stuff that's carried into the brain by the blood. If that blood stops, look at this one right here. So this is blood vessels feeding your brain. And normally the blood vessels, if you can see right here, the blood vessels, see that red? That's supposed to be everywhere. See that? And all those blood vessels, all those little happy fingers, they usually give blood and supply, and feed your brain. So you can think and do what you got to do, and everything, and run your life. Guess what that little blue party is right there? If you can see it. This is the best way to do it before I start talking about it and everything. That's a blood clot. So what did it do? It got in the way of this good, delicious blood that's supposed to go up here and feed your brain, because it's supposed to have blood and all these little happy fingers, which are your blood vessels that supply your brain with all the nutrients and stuff it needs. That's what it does. It's possibly a player hater. I don't know what you want to call it, but a clot is not supposed to be there. But they find their way and everything. So that's what causes the problem. So now getting back to cousin Tony said, let's see. She said, okay. I'm getting to it, baby. And stuff. Cause it's bleeding in the brain, a stroke. Absolutely. And that would be my next one. So I'm right at what you need to know about it and stuff. I will be going to that one next. First, I'm gonna go to the dry, what I call a dry stroke and everything. And then Auntie Josie said, oh, she's watching. And then Rosie Granny Allen, my mommy, she said the board is very important for this podcast. All right now, teach, teacher, teach. All right, I sure will. Yes, ma'am. And everything. So I'm gonna give you it's 3 types of stroke. I'm gonna go over each definition of them and tell you what they are. The 3 types are ischemic stroke. That's a dry stroke. That means a blood clot just stopped the blood flow. So there's no blood getting there, so your brain is dying and stuff. Then there's a hemorrhagic stroke. Like hemorrhagic means hemorrhage. That means to bleed to death, to keep on bleeding and you can't stop the bleeding and stuff. And that's a wet stroke almost. That's where it's too much blood going to the brain. So you're overfeeding it and you drown it, and stuff because the vessel bursts. So yes, cousin Tony, that's what that one is. And then also there's a TIA. It's called a transient ischemic attack. And that's what we call a mini stroke. Those are the 3 that I'm going to talk about tonight. So going back up to the first one, the dry stroke. That's the best way to explain it is it's a dry stroke because it's not letting the blood get through. Yes. Thank you. Thank you for asking. That was a good question, cousin Tony. So the ischemic stroke or our dry stroke, it's caused by a blood clot that blocks a blood vessel in the brain, stopping the blood flow. Like my little sign right here. The blood's supposed to come up and all of this is supposed to be red, but it's white because it didn't blocked it right there with the blood clot and stuff. So stopping the blood flow. This is the most common type of stroke, and approximately 87% of all strokes are ischemic or dry strokes. Okay, 87%. It's only 100%, and stuff of all the strokes or whatever and stuff. It's 87. So this is the most common stroke. That's why I'm talking about it tonight, because it's the most common. And we might find out by accident, and everything. Then you got a hemorrhagic stroke. This is a wet stroke. This is because I'll let you know in just a minute, but it's what we call the wet stroke because it's caused by a blood vessel in the brain that bursts or leaks, causing blood to spill into surrounding brain tissue, kind of almost drowning it. and everything. And it's really bad. And it's one of the most dangerous and deadly strokes to have a hemorrhagic stroke or a bleeding stroke. That's the most dangerous out of all of them. The survival rate is very low on surviving this one. And it accounts for approximately 13% of all strokes. So one is 87%. That's the dry stroke. And then the hemorrhage stroke, that's 13% of all strokes. So that's about 90 right there. What is that? 90? 100? Oh, that's about 100. But then there's also some other precursors. And you can't skip out on these just because it say many. That doesn't mean that it's many. It's giving you, it's snitching. This is called the snitching stroke, and that's the TIA, transient ischemic attack. And that one is also often called the mini stroke. It's a temporary period of symptoms similar to a stroke that's caused by a temporary clot or blockage. That means the clot wasn't big enough to just hold its own right there and stuff. It didn't get, large enough, so blood was able to still flow through and everything. And sometimes this one will resolve, or it go back and try to find some backup so it can become bigger and become a big stroke, and everything. So that's where that one comes in. So those are the three main types. And so another thing is, globally, I wanted to give you some statistics tonight and everything, and that would be the frequency of somebody having a stroke. These are good things to know, just to know that it's more common than not. And that would be every 40 seconds, someone in the United States of America has a stroke. Did you hear me? Not 60 seconds, not 1 minute, every 40 seconds. So in 2 minutes, you've been had 3 strokes, and stuff like that. That's how serious this is. So you see why I'm saying these things and everything. The mortality rate or the death rate. Mortality is mortal, like death and everything and stuff. And that is, stroke is the number 5 cause, number 5 on the causes of death in the United States. We're not worried about anybody else, and everything, but death in the United States, it's number 5 on the top, probably the top 5 is number 5 and stuff. So it's that serious. Another statistic that's crazy that I saw was strokes. Is number 5. I'm sorry. I'm reading it, but I'm saying 2022. Someone died of a stroke every 3 minutes. In 2022, in the United States, someone died of a stroke every 3 minutes. You see why I'm stuttering? Like, yeah, that's serious. Like, could you imagine that? Somebody died in 2022. We're at 2025. But remember, what was 2022? Still the pandemic. You see what I'm saying? So in 2022, someone died of a stroke every 3 minutes and 11 seconds to be exact. Could you imagine that? Oh, wow. Miss Josie, Auntie Josie said, let me see what you got here. In 2018, I had a stroke when I took my grandson to school. His teacher asked my, do I need help to call the ambulance? And I said no. And I was okay. So I left the school in Oakland and got on the bus and then took the BART downtown to San Francisco. And I was eating lunch and my daughter called me and said she noticed my speech was off. She told me to get to the hospital, which was 5 hours after I had my stroke. Oh my God. Okay. Yes, we're going to talk about this. So I go to the hospital and they asked me, when did I realize I wasn't feeling well? And I said, I was doing well. Okay. So I see what you're saying. So basically, you said that in 2018, you took your grandson to school and you felt something, kind of brushed it off, felt a little dizzy or something like that, kind of brushed it off, like maybe I just need to eat or something like that, dropped him off and everything. So your body was snitching because the teacher wanted to call ambulance for you, and you was like, no, that's all right. You didn't want to be a bother, huh? Okay, I understand and stuff. So then you made it all the way back to from Oakland to San Francisco, and went and had your lunch and everything and stuff. So you missed the window because it's only from the last time you were normal. Had you been abreast to Be Fast, you probably would have figured out that you were having a stroke all by yourself, let alone whatever teacher saw you and everything. So by this time you were at slurred speech. So I'm going to be going on to talk about this. So I want you to stay on, Auntie Josie, so that you can hear what I have to say about this and everything. But that's the classic sign that we don't know what's happening. So you kind of become kind of stellar, and you kind of brush it off. Oh, it's nothing. Oh, I'm having headaches. I have them probably about 2 or 3 times a day. I just get these horrible headaches and everything. But I take me some Tylenol, and then I'll be good after about 30 minutes and stuff. But yeah, Tylenol doesn't heal whatever's going on to give you a headache, because your body is snitching. The headache is a symptom. Your body is snitching. But we go ahead. I don't feel like being bothered because they're going to get me in there. What they're going to do, stick me and try to run one of them EKG things on me, and stuff like that. And it's common. So you didn't do anything wrong. You just kind of risked your life, Auntie and stuff. And I'm so sorry that happened and everything and stuff. But that's what we do, especially if we don't know. So actually, it's not your fault as far as not knowing, but it behooves me, because that's why I'm on here. Just what you just said is the reason why I'm on here, because I need to tell you about Be Fast so you can catch something like that. And the next time, this won't happen to you again. But actually, if that ever happened to you again, where you're in the position to have a stroke and stuff, you might not make it. So we know the good Lord was looking out for you and stuff, but at the same time, that's how dangerous this stroke is, because it doesn't hurt. If you was having a heart attack, at least you'll grab your chest like, oh gosh, or something, something weird would have happened. These are silent snitching, and stuff. These are silent telltale signs. You didn't get an extreme headache or nothing like that. You just noticed that you start being a little off. You was a little dizzy. The world starts shaking or something like that. I could just imagine what you were feeling, but you were still trying to play it out. I need to eat. Let me eat and stuff. Then I'll be okay. And eating wouldn't probably. I'm surprised you were even able to eat, but you were on the phone talking because the stroke. See, I got to tell you. I'll tell you in a minute. Oh my God! Thank you. I thank you for your testimonial. And then Miss Sandra said, so is there any one thing you can do to prevent a stroke? Yes, I have all of that lined up in this power pack, and everything. So thank you for asking that. And Auntie said yes, and I will. Absolutely and stuff. Stay tuned, because I'm getting to the good part of what we're talking about. Okay. So also some statistics I just want to go ahead and run down is stroke is the leading cause of disability long term for adults and everything. And that's when you get the little arm and it curl up. It can be left or right. It doesn't matter which one, curls up and stuff, but you get that, and that one leg you dragging on the side and stuff, and you're never walking upright and straight anymore and stuff. So it's a disability because you might not have been able to walk after having a stroke, and everything and stuff. A lot of times, a lot of people aren't able to walk and everything. And that's when I'm gonna go into symptoms. And this is really gonna get you guys good, because you're gonna start seeing what I'm talking about exactly. And that is the global impact. I just want to make sure that I say this and everything is In 2021, this is 2021, around the pandemic time and stuff, we was wondering why everybody was, kind of dying. It was that stress that led up to, COVID and all of that stuff, but it caused some other things to go wrong with people, a lot of people. There were nearly 12 million new strokes worldwide, 12 million. And globally, 1 in 4 people above the age of 25 had a stroke or can have a stroke in their lifetime above the age of 25, meaning they could still have one at any age, make no mistake, but 25 and above, you're at risk. I'm at risk. Just because I'm a nurse don't mean I'm not at risk. I got to do what I'm telling y'all to do, and everything. So this is where this comes in at. So I want to give you some cause and risk factors. And that is the main causes are blood clots or ruptures. Blood clots are dry strokes. Ruptures are wet strokes or hemorrhage strokes. That means you either drown your brain, or you either have a dry brain, which means the blood is not coming. So it's very important that you know the difference between those. And the wet stroke or the bleeding stroke is the most dangerous, Cousin Antoinette. Okay, so then we go to factors that you can control. So these are things that you can do for these risk factors and everything. And the controllable things is, if you're diagnosed with high blood pressure, you need to know your numbers, be at the doctor regularly, and get you some help so that you don't have a stroke. Okay. Welcome on in, Miss Michelle. Thank you for coming on. Yes. Hey. And stuff. So you see that. So high blood pressure is the number one. Okay. And it's the most significant. It's responsible for over 56% of all dry strokes. Yes, it's a big deal. And then guess what come in second? Diabetes and high cholesterol. Yeah. No. Diabetes. So it don't just bring your blood sugar up and cause you to be hyperglycemic, which means you got too much sugar in your body, and it causes all that other mess to go down. But it also teams up with cholesterol and makes them a nice little gooey clot. And then it plug up somewhere and jack you up for life. Yeah, we don't like diabetes. We don't like high cholesterol. But if you have it, let's go ahead and work on controlling it. You can live still, and stuff. So you got to work on controlling these things. And guess what it says? These are controllable things. If you get these in check and be on that high blood pressure medicine, whatever works for you and your doctor, and y'all work it out and everything, whatever that may be. Or if you got diabetes, getting your diabetes under control. If you can't reverse it or go back to a lower A1C and all of that stuff like that, at least getting control of it, knowing that you have it. Like, I ain't going to the doctor. They're going to tell me I got diabetes. Well, you're going to die. If you don't go, you better do something. You better tell on it. It's telling on you. So you see where I'm going with this. So make no mistake. These are the top ones that cause it, because they dance together. The high blood pressure is pushing up against those arteries and causing more pain to your heart because the pressure is high. So it's, instead of going boom, 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 it's going boom, 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 pounding. You know what I'm saying? It's tearing your heart up. You only get one, and stuff like that. So it's doing that. And then guess what the other little monsters is doing? Diabetes. It got that sugar, so it's making your blood thick. It's a hot mess. It's everywhere. It get things cut off of you and different things like that and stuff. Diabetes and stuff. Cholesterol. That's your fatty, your lipid, your fat stuff, and everything. So it's making it all greasy, and it's creating sludge inside these arteries that got to deliver blood. So it get thicker and thicker. I looked at it like I don't know. A lot of people use ground turkey now and stuff, but if you the good old fashioned ground beef, you fry it up and all that grease. You go walk away and go do something else and stuff. And you leave it on there and it cool down, and it's a big old cake of white stuff. That's what cholesterol is sitting inside your arteries, tearing you up, plugging it up. Welcome on in, Trina. Welcome on in. Yes, she said, "Hey, sis, wow." I know, huh? Your girl on here teaching. I'm teaching. Yes, good to see you on and stuff. Stay tuned, okay? Hang out with me for a minute. All right. So you see what I'm saying about that? So cholesterol is that fat, gooey stuff, and it causes it to, it hooks up with the glucose. You diabetes is too much glucose mostly, and stuff like that. So they hang together, and then they get married together and stuff, and then they all in your blood, causing trouble. And then a high blood pressure is pounding and beating the heck out of your heart and stuff, causing undue rest for your heart and stuff. And then this is a perfect storm. And guess what? It comes from all the foods we put in our bodies. Even when we're trying to be good, it's still gonna get us somehow, because we need certain things. No matter what kind of diet we're on, if we're vegetarian, vegan, pescatarian, whatever we are, carnivore, and all of that stuff. This is where we get it from, our foods, processed foods and different things, the Lunchables, not so lunchy, and whatever else and stuff. So I said high blood pressure, uncontrolled, is a stroke. High cholesterol and diabetes is a stroke. Smoking, and guess what? For my little youngsters and stuff, that forever young, forever young and stuff with that vaping. Vaping it's nicotine and stuff. So vaping / smoking. I'm just saying. I'm not for smoking cessation would probably be your best out, because these are controllable things. You can control the blood sugar and monitor it. You can control the blood pressure and monitor it. You can control the cholesterol and monitor it. So these are controllable things that can keep you alive and prevent a stroke. Okay? Obesity. You can control that. Guess what you got to do? Probably, drop a few pounds, however that looks to each and every individual. I'm not on here to judge. I'm on here to just inform you and everything. So dropping a little weight and everything. But another cause of stroke is physical inactivity. You mean to tell me you don't exercise at all? Where you live at and stuff, so I could come live there too, because I don't like exercising, but I have to. It ain't no way that I can live my life and not be able to put something in, because it's no way. I won't live. I can't live. And you can't either. Yeah. Okay. Another thing that's controllable, but it causes a stroke. Unhealthy diets and excessive alcohol use. I got to have my Patron, my Hen, my white label, blue label, whatever they got and stuff. Yeah. I'm just saying. I'm not for or against anything and stuff, because if you do it in moderation, you live. If you do it in excess and you are always drunk and falling all over the place, that's probably a problem and everything. So that's all I'm saying. It's controllable and stuff. Unhealthy diet. So that's another part of, we like a little Taco Bell, a little McDonald's, and even if, Texas Roadhouse, Ruth and Chris, whatever it might be. It don't have to be a cheap little McDonald's or Wendy's or something like that, but it's something and stuff. Just remember, McDonald's didn't actually want to tell you how many calories are inside the Big Mac or the quarter pounder or, whatever it might be. They didn't want to tell you that, but you see it's up there, huh? How much calories in a frappe or whatever and stuff like that. Why do you think they did that? because they were forced to. They had to do it and tell you that you eating poison. Okay, I'm just saying, and it's innocent enough, but until it's serious and you have a stroke, you know, any one of us, even the nurses, even the doctors, have had strokes. Okay, and then another one is heart disease. So it doesn't just stop at high blood pressure, but it's also heart disease, like it's called coronary artery disease. Coronary means heart. A artery is a big vein, and disease is means that we don't want it, but it's there and stuff. So those things are the ones that cause trouble, like atrial fibrillation or AFib. That's an irregular heartbeat. That means your heart is not beating like the regular boom, 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 boom. It don't know what to do. It's like, hey. You feel it though. Oh, my heart is racing. Oh, stop. Yeah, you don't want it to stop. But I'm just saying. Welcome on in, Maria. Cousin Maria's on and stuff. Thank you for coming on. Yes. So I just did some controllable risk factors for stroke. So I'm gonna just run through them real quick, just for anybody that didn't hear and stuff. High blood pressure is number one. Diabetes and cholesterol, high cholesterol, is number two. Smoking, and this includes vaping, is number three. And actually it includes the swishers that you put marijuana in. So marijuana is not even out off the table. If you use the little swishers or the little papers and you wrap them up in tobacco paper, you're smoking tobacco, which is just like smoking cigarettes and everything. Okay. And then obesity, so being over your BMI, body mass index, and physical inactivity. No exercise, just none. Except for if that's the exercise, it probably exercise that one arm. Okay. And then unhealthy diets. Yeah, we all guilty. Every last one of us. I don't care. Every one of us. And excessive alcohol use. And then we got heart disease, like coronary artery disease, which I told you is just stopping up your artery with a blood clot, because it's all that sludge from cholesterol and diabetes dancing around, glucose dancing around inside your veins and everything, stopping them up. And AFib, which is that irregular heartbeat. I said your heart's supposed to go kaboom, kaboom, kaboom. It's going boom, 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 boom. Yeah. That's not right. Okay. Non-controllable reasons to have a stroke would be, okay, I don't know how I fit that in there. Okay. So one that you can't control is your risk. Your risk for having a stroke doubles each 10 years after the age of 55. So 65, 75, 85. You make it to 95, you already doing good. So you already know what's up. Okay. And however, strokes can occur at any age. Our kids can have them. Let them keep eating that stuff. You go, my baby eats good. Do they? Is you paying attention? Yes. Maria said, hi, everyone. Yes. All right. And stuff. So that's one. Another one is family history and genetics. So you might have this gene that causes certain things to happen, which makes you at higher risk for a stroke. So that's one thing. And then another one is, these are things you can't control, is your race and ethnicity and everything. You know, African Americans being top on the list, followed by Hispanics, and then other ethnicities and stuff, which would be Pacific Islanders, South Asians, and different things like that. They all come in, you know, statistically higher at having strokes, believe it or not, and everything. And also gender. Strokes affect men faster than women, but women usually die from a stroke faster than men. Men can have a stroke and then have another one, and then they might pass with that one and stuff. So it's still serious, no matter how you look at it, no matter how you turn around. But the one thing I want to hammer in before going to the good parts about the parts that you need to know about stroke is they can happen at any time. Anytime, you guys. So that means you got to watch your teenagers. You got to watch your children. You got to watch their stress levels and what they're going through and stuff. Just feeding them because they eat good and stuff. I have to buy 2 packs of chicken, to feed my son or my daughter and stuff like that. Yeah, that's not cute. They need to have a plate, and they need to learn how to eat till they're full and push the plate away. Not seconds, thirds, fourths, fifths, and stuff, or until it's all done. And then an hour later and stuff, they still ain't even digested the food, and they at the stove eating. Auntie Josie said, why women die faster than men? I don't know. I guess that technically or genetically they're stronger, so they can take a little bit more than us. Even though we do take childbirth and everything like that, but statistically, we die faster from having a stroke than men and stuff. That's not to say that it's probably dead even right now and stuff like that. But yes, we die a little bit faster. But that's probably because we have a lot of other risk factors, like we are birth givers and stuff like that, and so we have a lot more. We have menstrual cycles and everything, menopause, even though it's for men and women and stuff, it hits us harder than it hits men, and stuff like that. So it's a lot of things that shorten our life span health wise, unless we stay healthy and try to fight it and stuff. So that's usually why women, it's so much put on us. Even though we're the women and we're supposed to be genetically weaker than the men and stuff, it still affects us a lot more harsher and stuff. So I hope that answered your question. Good questions, by the way. So let's say you had a stroke. And we're going to talk about the dry stroke, the most 87% of the world stroke of United States strokes. What is this? Oh, my uncle just he just texted me and stuff talking about who loves you, baby. Uncle Ricky. Yes. So going back to the actual strokes. Cousin Tony said, can you get your brain scan to see if you're in danger of a stroke? They wouldn't, unfortunately, they wouldn't, because brain scans cost so much money, even by insurance, even with good insurance and stuff. They wouldn't pre-scan you, but what they would do is work you up and pre-screen you. And then you might be able to qualify for an actual scan and stuff. And the reason why they wouldn't do it first is because they want some other things done first. And that would be making sure that your blood pressure, that you don't have high blood pressure. And if you do have high blood pressure, you to already be going to them, the doctors, they want you to already be going to control your blood pressure, because these are controllable things. They want to know your numbers for diabetes, so that they can diagnose you with pre-diabetes or whatever and stuff, or diabetes type 2 or something like that. So that will be your second thing that they will be checking, all before you can possibly get a scan. Now, if you're at risk after they check your cholesterol, your diabetes, risk for diabetes, or do you have diabetes, and your blood pressure, and do you have high blood pressure, once they check at least those 3 things, then they may work you up for having an MRI or something like that, where they can check you for a risk of having a stroke. But they're going to do a whole bunch of other things first before they can just scan you. They have to have a reason, because insurance don't want to pay nothing. So they want to check other things before they graduate you up to a scan, and that would be that diabetes, your cholesterol levels, and stuff. Are they within normal? And then also they want to know other things like are you swollen and stuff like that? Because I just did kidney disease and kidney failure last week and stuff. They want to get your kidney functions. So they're going to check all your blood. They're going to check all types of things and everything. And then they may give us a scan, and everything and stuff after they check about 150 things. But yes, and stuff, still tell on it. Tell on it. If you got a problem and it ain't been solved in a while or something like that and stuff, tell on it. It's okay. It might save your life and give you 10 more years, and stuff, just from a simple office visit. But it can't be an office visit where you look at him and he look at you, or you look at her and she look at you and stuff. You got to tell on it and tell it all. You got to confess everything and stuff. So I was going to go to, let's say, hey, a stroke is trying to visit. This is the craziest part, but I just want to, I pulled out a little fact sheet on this and stuff. And that is your brain, it has a left and right hemisphere, a left and a right hemisphere. But when there's a brain attack, which is called a stroke, a brain attack, your brain is like this. So if it attacks your left side of your brain, your right side of your body is in trouble. If your stroke happens on the right side of the brain, your left side of your body is in trouble. So inside our beautiful, marvelous brain, we got all these things that are responsible, that the brain is responsible for: the left, what they call hemisphere, and the right hemisphere and stuff. If you get a left-sided brain stroke and everything, it affects the right side of the body, causing you to be paralyzed or severely weakened and numbness. I can't feel anything. You see what I'm saying? And this is just the left side. The left side is also, if it attacks your left side, it's going to be your right side, but it's going to be your right side affected. But it also, if it's on the left side, it will affect your speech. You will not be able to talk. You will become non-verbal, not able to talk at all. It takes away your speech, your language. You won't be able to understand anything. You will not be able to read, write, or do any type of equation, like a math equation or anything. It takes all of that away. Just on the left side, a left brain attack is responsible for these things. You will not be able to logically think, which is a cognitive thing, but you won't be able to think and stuff, because we got to keep it in layman's terms and stuff. So you see where I'm talking about. This is some crazy stuff, but it's definitely, this is what happens. If the stroke is on your right side of the brain, hello, left side, the rest of your body is in trouble. And these are some of the effects that it will affect on your body. It will cause paralysis, or you to be paralyzed. That means you can't move it. You have no control over that side. That's why you see the people and they just, it's almost gone. It's really serious. But so it's paralysis, it's weakness, and you'll know it's severe weakness. You can't even stand. It's the wobble leg and all of that type of stuff. It also affects, if it's your right side, it affects your left side, but it also affects your vision. You can go blind. You can lose part of your vision or both eyes, blind in one eye or the other, or the whole thing, just blind all the way and stuff, which is, yeah, that's serious. I lose my sight. And yes. And most of the time, if it's the right side, if I will get to that one, Cousin Maria and stuff. If it's the right side, it's doing the left side. So another thing is called what is it called? It's a neglect and everything, but it's like putting your hand up to your eye. Okay, it's the right side, so this is the left side. So putting it up there so you can't see. It'll cut off your vision where you can't see. It's called peripheral vision, where if I'm looking straight ahead, I can still see on the side of me. I'm looking straight ahead, I can still see on this side of me. I have a stroke on the right side of my brain. On the left side, I can't see anything on this side. I can see on this side, but not this side. That type of stuff. It's crazy. Yes, it puts up like a shade or something, a wall, and you can't see past it until you rehab and everything, and you might get your vision back, and that's not a guarantee and everything. So Cousin Maria, you said what causes stroke and everything. I'm gonna go back real quick and stuff just to say that and everything. The causes: uncontrolled high blood pressure, unmonitored high blood pressure. That's one. That's the number one. Number two would be diabetes. Diabetes, period. But diabetes type 2, usually, if you wasn't born with type 1 juvenile diabetes and stuff, diabetes type 2. High cholesterol. So that's what fatty material, and stuff. If you're eating a lot of fatty type foods and stuff like that. So everything needs to be low fat or, different kinds of oil, saturated and trans fats and stuff like that. It's a whole bunch of stuff like that. But cholesterol, smoking, you said causes: smoking or vaping or smoking marijuana inside those papers. They're tobacco papers. Tobacco is nicotine and stuff. So that. Obesity and physical inactivity. No exercise, and you're over your body mass index, or you're overweight, overweight and everything. Not just fat people or something like that. I'm talking about just over your weight. And most of us are over our weight for our height and, and everything. Unhealthy diets. If I have a diet of Taco Bell in the morning, IHOP in the afternoon, and Chili's in the evening, and then Cheetos in between and stuff like, I'm probably not gonna have a lot of stuff good going for me. I'm just saying. Heart disease and atrial fibrillation. That's the speedy heart thing going on and stuff like that. These are all things that would cause they're controllable, but they will cause that. Things that are not controllable would be your age. After 55, your risk doubles every 10 years after 55. So 65, 75, 85, 95 and everything. Family history and genetics. If you have a lot of strokes in your family and stuff, pay attention and pray attention. Race and ethnicity, starting with African American, followed by Hispanic. So Maria, my cousin and stuff, but I'm just saying, those things. And then gender, men faster than women, but women, it's more dangerous as far as death. It's more on women dying faster. And so I want to talk about symptoms. We might be having a stroke. So behind me, I don't write these for nothing, you guys and stuff. You might not be able to see them, so I'm going to go over them, but I just want you to know what that is. It says be fast. This is the universal, like if I'm going to call the police, I'm calling 911. So be fast is your 911 for a stroke. So I see Cousin Tony wrote something and stuff. And guess what I'm supposed to be doing? Where they at? I'm not going to do it. Ooh. Thank you, cuz, for putting in the work and passing this good information on to us. You are appreciated. This is some good knowledge you're passing on, because knowledge is power. Thank you. Thank you, cousin. I appreciate you. Yes. Oh, she gonna make me. Woo-hoo. Okay. Thank you. Thank you so much. And thank you, Maria. She also said thank you and stuff. Oh, you guys are wonderful. And I appreciate you guys coming on because you're gonna be my mouth. And everywhere you go, you spread this knowledge also because knowledge is power. When you don't know, Auntie Josie and stuff, you can't do it better. You can't redo it and everything. But God gave you a second chance by allowing you to live through that and stuff. So at that time, and stuff, you didn't know that this was more serious than, or you would have went in that ambulance when the teacher said, "Can I call an ambulance for you?" You made it all the way back from Oakland to San Francisco and was sitting down eating, and your daughter was on the phone. My cousin Mildred was on the phone talking to you and said your speech sound crazy. Like, is something wrong, Mom? And stuff. She was able to recognize that because she's probably been privy to that information. So she knew something was wrong and told you immediately, call 911. And that's what really literally saved your life, because it could have just kept on progressively until you just fell out somewhere and nobody would have known what to do with you and everything. So that's how dangerous that could have been. And it was all because you didn't know. If you knew what you gonna find out today, we wouldn't even be talking about this. So you see where that is and stuff. But I'm so glad you're alive and well to still be the loving young lady that you are. Oh my God. Yes, you said I did get better with my stroke. I had rehab and came back 100%. Yes, God is good and I'm so blessed. Absolutely, God is good and you so blessed. Absolutely. Yes. And you said I took the bus to. Wait, you took the bus? No, you was pushing it. But I'm glad you made it. And I'm glad that you were able. I'm glad that it probably was not a big blood clot, but you did have to, even a small stroke can cause you to have rehab where they have to exercise you and bring back your deficits. And deficits means something where you got increased weakness. So then they have to bring that back and they have to get you kind of Iron Man and, and get you in shape. Yes, Auntie, she said yes. Okay. I know. I was like, you took the bus to the hospital. Yeah, that was a little pushing it, but I'm glad you did still go. You knew to go to the hospital. That's all I'm worried about and stuff. And now you made it. That was 2018. This is 2025. You are a walking miracle, believe it or not. Okay. So the most important thing of the hour is, let's get to this be fast. This is how everybody is going to be able to save somebody, or at least tell on them. If they don't choose to listen, you keep that for yourself and everything. But if they do listen and stuff, you can, it's so easy to remember this. What is that? If somebody having a stroke and stuff, be fast. Okay. Because I'm about to tell you. B, balance. I'm losing my coordination. I'm losing. I got the wobble, the rubber legs. My balance is off. That's number one telltale sign you might be having a stroke. Okay, balance. E, for be safe. E, eyes. They're blurry. You might even get a vision loss where they're just glossed over and you can't even see out of one or the other or both. That's a problem. You might be having a stroke. F is face. It almost seems like one side is melting. You lose all the muscle tonicity. And so it kind of hangs down. That's the only way I can show. I don't know how to. But anyway, I'm just saying, one side or the other. If you see somebody, you walk up to somebody and they have not had a stroke or something like that, and you see that they didn't had a stroke before, or they're having one right in front of you. Yeah, it's distinctive, and it tells the tale and everything. So the facial, it's called facial drooping. It almost is like a candle melting down. That's how your face on one side or the other. It'll pick a side because it depends on which side of your brain it's going to attack, because it's a brain attack. So the facial drooping on one side. A way to check it just in case, and stuff. You can ask them to smile. If they smile, hey, I probably am not having a stroke. I smile, right? But if you're having a stroke, yeah, you gonna see it. It's gonna go down. You'll see it, and you be, oh, that's what Charlene told me and stuff. Oh, Auntie Josie said when she had her stroke, she was in rehab for 1 month. Oh my God. Well, at least it was only 1 month. Some people, they don't come out of rehab. They have to end up staying at what they call a skilled nursing facility, where the nurses come in and they kind of bathe you and stuff. It's a rough little setup, and everything and stuff. But I'm so glad that you are recovered to tell the tale and everything. And wait till we come out with these testimonial Tuesdays. Then I'm gonna be getting y'all on here, and y'all gonna have to show your face, and you're gonna be right next to me on here. But anyway, as I digress, so that was F, facial drooping. A, B, fast, FA, is arms. And they won't be able to stay up. So you could get, if you want to test somebody to see if they're having a stroke, you tell them to put their arms out, because even if they don't know it, because it don't hurt or nothing, they just get weak and they don't even know that it's happening to them and stuff. But that arm will drift. They can't keep them up. One or the other is going to drift down. They just can't keep them up straight out. They're going to drift down. They're not going to stay up. Or maybe one side will stay up, but one is going to go down. And it's that marked weakness. So then there's S of B, fast. S, speech, slurred speech. It's almost as if your tongue swelled up. It's this funny, distinctive sound. Slurred speech, they associate it with overuse of alcohol. The drunk is has the slurred speech and stuff like that. That's how the police know that they might be driving under the influence of something. But for stroke's sake, that the quality of what you say is dragged out. It's kind of what we call garbled speech, balled up speech. It's you stop making sense, and you stop being able to be understood, because they can't tell what you're saying. You're saying the mountain is high, but what comes out is hard. Yeah, I don't know what that means. You see what I'm saying? So it's messed up speech. The quality of your speech, it just goes with a new onset stroke. And then time. Time is of the essence. When was the last time I was normal? So Auntie Josie, with her testimonial earlier in the podcast, she said that by the time she figured out that she was having a stroke, 5 hours had passed. Yeah, you can't wait 5 hours. You got to, as soon as you catch the first two, balance and eyes, you should be ready to call. If you get to the F of be fast, you get to that F, which is facial drooping, you better know it. Somebody got to call the po-po on you. Somebody got to call the police, because it's a problem. It's a medical emergency. And guess what? You don't find out and you let it stay, it's just going to take over your whole body and possibly take you out altogether. So if my Auntie Josie wouldn't have went to the hospital when she did, period, she probably wouldn't have made it through the next day. She would have probably passed before she even made it through the next day. She went on home. Let me just sleep it off. And so I feel okay. I still got my faculties about myself and stuff, and went to sleep. She would have had that stroke, and it would have progressed deeper and deeper into her sleep, and or she could have fell in a shower, trying to take a shower and stuff before going to bed or something like that. So it was so many danger points at that time, and thank God she knew I got to get to the hospital. They'll take me on from here and stuff, and they'll start running all this stuff. And I bet you they was running around like crazy, and she just looking like I ain't even that sick. Yeah, it don't matter. They know what they see and everything. So yes. So time is of the essence, and that is where the treatment comes in and everything. You got I think they got up to 4 hours now and stuff, but you got to, from the start of when you first, figured out that something wasn't right, that all counts in your 4 hours. They got to get a CT scan. They got to get you, you got to get to the hospital. You got to tell them what's going on. They got to get you in a CT scan, all of that stuff, and it better go like clockwork within minutes. They have stroke teams. I was on one. I kid you not. And so they have stroke teams, and they got to get there. They roll around in the entourage of about 10, 15 of them and stuff. And they all got a special job and stuff. And they go in on what they call hot strokes. That means right now it happened. It's acute and not cute, but a hot stroke and everything and stuff. And they got to get in, and they got to do all these different things to you and stuff. And they got to see. And if you get in, and you're not in time for what they call this medicine, it's called TPA, tissue plasminogen antigen or whatever and stuff. Of course, you don't know what that is and stuff, but TPA and stuff, which is a clot buster. It breaks up a clot so that their blood can go and don't be stopped right there. And it actually goes through your blood vessels and everything and stuff. If they don't get that medicine in on time, there's some trouble. And stuff. And even when they did want to give me the medicine for the clot, but they gave medicine for the clot, but they gave it to me anyway. Okay, so do you remember by any chance which medicine they gave you? Because they probably couldn't give you TPA, because if you're out of the window, they can't even legally give you that medicine. Now, they could give you another kind of clot buster, or they can do a procedure where they go up into one of your arteries, your big arteries. They find it first where it's at, and then they go into that artery and go up through your artery system and go in there and snatch the clot and pull it back out and stuff. And it's a whole bunch of fancy stuff, but I'm just saying I've been privy to that information and everything. But that would be what they would usually do. Now, they will give you stuff as preventative, like this stuff called Plavix. They got all these different medicines and stuff that they can give you. Yes. Okay. So my mom, who came on, she had Auntie Josie, she had her stroke in 2017, and she had a full-on stroke. And guess what? We were at the doctor's office, and they were like, Rosetta's daughter. And I'm like, I'm Rosetta's daughter. And they were like, can you come over here and stuff? She was where they do the blood draws and stuff in the phlebotomy corner and stuff. And they were like, your mom fainted. And I looked at her, I was like, yeah, my mama don't know how to faint. Yeah. I'm like, she don't know how to faint. I don't know what y'all talking about and stuff. I get over there, and my mother is like this. I said, Ma, I'm shaking her. I said, Ma, I'm gonna call the police, and stuff. I'm screaming at her and stuff. And her eyes rolled in the back of her head. I said, oh, and I flipped my wig and stuff. And they already knew the wherewithal, because she was in the doctor's office. They started taking her blood pressure, and I seen it. I read it, and they had it going, cycling like every 3 minutes or something like that. And it was 187 over 98 or something like that. Then it was 207 over something. Then it just kept going higher. I said, she having a stroke. I started screaming, like, screaming at them and stuff. And so they put her in a wheelchair and stuff and took her into one of the rooms and stuff. I said, call 911, tell them it's a hot stroke and stuff. And they let me run it in the doctor's office and stuff. I'm screaming and stuff, but at the same time, guess what I knew? I knew to actually ask, when did they see her go down? They told me the exact time. I was able to tell the ambulance person the exact time she got in, and under I think it was 3.5 hours at that time that you had between everything and stuff. The stroke team was called to the hospital that she was taken to. And, I had to gather myself together and stuff because I'm, mama, and stuff like that. Gather myself together, jump in the car and make it down to the ER where they let me into the back and everything and stuff. I come in there, and one of the stroke team nurses, another registered nurse and stuff, she was like, "Hey, Charlene, what you here for?" I said, "That was my mama," and so now I turn into a big old baby. I can't be a stellar nurse and stuff. This is when life be life, and I'm just saying and stuff. So I was able to watch. She said, "Come on in, you're gonna watch a hot stroke," and what we really do and stuff. And this is a part of the stroke team. So I watched them do all the checks and balances and everything, give her the medicine. And then the most beautiful part, no, it wasn't beautiful. The worst part ever is when she went up to ICU after receiving the clot buster medicine that thins her blood and thins the clot out and everything. They told me I had 24 hours to watch her, and she could, if it helped her, she would be okay in a matter of a few days and stuff. If it did not help her and stuff, she would bleed out and pass. She would die. So, being that I'm a registered nurse, what that probably did to me, that's my mom. You see what I'm saying? So in all honesty, you wonder why I'm on here. Wow. And stuff. So Auntie Josie said, "I don't know what medicine, but they said it was the one they give to everyone when they first come in." Okay, so it's possible they thought that you might have made it in on time or something like that and stuff, but it might have been a different medicine and stuff, like even a heparin drip, which will actually bust up a clot. Also, it'll thin your blood, which will thin the blood clot and everything and stuff. So there's a lot of therapies and stuff. I'll look it up and everything and stuff, and we'll talk about it in more detail after the live and stuff. But if I come up with the right information and find out what the medicine was, I will definitely put it in the comments after this live. So thank you guys, and thank you, Josie, for that and stuff. I'm not done yet and stuff, but also cousin Antoinette said, can high cholesterol be reversed if you're taking medication or not? Absolutely. These are controllable things. Diabetes can be reversed or almost down to pre-diabetes again from advanced diabetes, and also high blood pressure. If you get it in control, you can even come off of blood pressure medicine. I did it. But you can come off of blood pressure medicine if you get it controlled and everything and stuff. And then cholesterol, you can be diagnosed with high cholesterol, and you actually have to change your lifestyle, eat better and eat differently, and take some medicine that will help lower your cholesterol levels of bad cholesterol. Because some cholesterol is good, but the bad cholesterol, we usually have too much of, and we need to lower those numbers. So absolutely, it can be reversed. Thanks for asking that and stuff. So let me see. Maria, she said, you're an amazing woman. Oh my God, don't be making me blush now. You're an amazing woman. I'm glad you were there to support her. We love you, Auntie Rosie and Charlene, and we love you too. You and the babies and little Demarie that just turned 1 with his little fine self. Ooh. But anyway, he just a cutie and stuff. Just turned one, little man with a little mustache. No, he ain't got no mustache. But anyway, Auntie Josie said, "Thank you, Maria. I told them it happened at 8, and I got to the hospital around 4." Oh, yeah, they probably didn't give you the clot buster TPA because you were out of therapeutic range for that, but they probably gave you the next best thing. So yes, they did give you something to help, or you wouldn't even recover. You would have still been paralyzed or partially paralyzed on one side or another and stuff. So they definitely gave you something that did help you out and stuff, Auntie. And I'm gonna find out what it is though and stuff. So yes, that's good. But thank you guys and stuff. Maria said, I was on high blood pressure medication after I gave birth. So you probably had that thing called preeclampsia. Oh, she said it right here. Yes, preeclampsia. Yes. And that's something that's brought on by pregnancy, just like diabetes, gestational diabetes and stuff. That's another one that I talked about on my diabetes session a few weeks ago and stuff. And yes, and you did it for 2 months. Yes, and it was to save the baby. That's why they do. Well, to save you also, because you could have passed that childbirth, So it's very dangerous and stuff. But these are two of the things that they really watch out for is your blood sugar, making you drink that sugary stuff. It's called a glucose tolerance test or something like that. And then they have the preeclampsia, and that's when the blood pressure is too high for the mother, which puts pressure on the baby and stuff. And so the baby could get real sick or pass inside the stomach, and everything. So they're very dangerous and stuff. So they have to give you something to lower your blood pressure. So definitely, this was serious, but I thank God you guys know how to tell, because guess what? If you didn't tell and you just, I didn't have me some babies before, I already know what I know, and stuff like that. Yeah, you will faith around and find out. Yes, and stuff. And it's dangerous. It's absolutely dangerous and stuff. So yes, I appreciate everybody coming on and telling their stories, because this is crazy. Oh, this is another good one. Okay. After I gave birth, I had this slight headache that I didn't want to say anything about, but something kept urging me to say something. Urging me to say something, and I'm glad I did, because they end up giving me the magnesium drops and keeping me in the hospital for 10 days to monitor, and I left on high blood pressure medicines and lasted 2 months. I see, because guess what? You could have went home if you didn't tell and snitch, knowing that headache is not normal for you. If you did not snitch, because I said your body is a snitch, it was telling, because it don't want to die. Even if you might want to die, it don't want to die, and stuff like that. So it's going to snitch. And how do it snitch? It got to do something. So it gives you a symptom. A symptom is a snitch. A snitch is a symptom. You see, my business is your body's a snitch. Believe it. That means you got to believe it. It's telling on your body. So you got to believe that and stuff. And this is prime example. These testimonials, I thank you, Auntie Josie. I thank you, Maria. I thank you for everybody that participated and stuff, because this is what I'm here for, this type of stuff. And what you're talking about is magnesium. I know somebody else that had to be on magnesium also in order for, the babies to live, and everything and stuff. And so this is very important that you tell on this stuff. You can't, it should be an instinct inside your body that's, I'm too uncomfortable. I can't do this, and stuff. This is bad, and everything, because it's literally that bad. Wow. I thank you for definitely telling on yourself, because your body was telling on you and stuff. You said, thank you, Lord Jesus. I remember you kept telling me to tell them every symptom. Absolutely. Because if you don't tell on your body, how can they help you? They can't. They're not a genie. You know, that you got to actually say that I got gas. I haven't pooped and blah blah blah. You know, or something. You got to do that, because that could turn into something else. That could turn into something else. Or you could have went home, breastfed for a while. That's already stressful, and then passed away in your sleep. Just went on to sleep and never woke up. Fresh mother, you know, into motherhood and stuff and everything. And then what would the babies do? What would your kids do? You know, and everything. You said I started feeling sick in a different way. It was a funny. Yes. So when I say your body is a snitch, it ain't gonna just, hey girl, you should probably do something about that or something like that. No, it's gonna say, if you don't, I add some friends to you. I can give you a not feeling well, having a headache, and then I'll make it go in your ear, and then you'll feel like you got a heartbeat in your ear, and then I'll make one of your arms start hurting like it's gonna fall off and stuff, and then let me make her dizzy and slightly blind her. Oh, she still ain't telling? Okay, I'm gonna put her to sleep forever. You see what I'm saying? Yeah, I'm gonna do this. Oh, come on over here. Mess with her optic nerve and stuff, and mess her eyesight up. Okay. Oh, she still ain't. Give her some indigestion and make her start throwing up nonstop. Oh, I'm gonna put her to sleep. She a trooper. Okay, I'm gonna put her to sleep because I did this. She ain't told nobody. Okay, then I did this. Oh, she roughing it out. Oh, she's strong. Oh, okay, and stuff. I'm gonna do this. Oh, you see what I'm saying? Boom, it's over. Okay. So I'm glad I got to interact. I only stayed on a little bit longer. I hope I didn't lose it. Well, heck of people, but I stayed on a little bit longer. Please come back and watch the replay and everything on this. I didn't get a chance to do a lot of the treatments and everything, but they got clot busters and then other medicines to bring down high blood pressure, to bring down, you know, from a stroke, because it's caused from this, to bring down your cholesterol levels, to control your diabetes. But you got to make the choice to go get checked out so that they can see what they need to do as far as treatments for a stroke, because a lot of things can be controlled if you get them under control, like high blood pressure, diabetes, cholesterol. If you get those all in check and under control, and there's medicines for all of these and stuff, then you get control back of your life, and you can live. If you let it just go and you try to be a trooper and you try to stick it out, and don't bother. No bother. I only get this one life. It'll never be another me. It'll never be another you. This goes for men and women, because we both can have strokes. It goes for human beings and stuff. So at the end of the day, your body is a snitch. You better believe it. You guys gonna have to go back and watch the replay. I might do a part 2 to this. Thank you, Auntie. She said, thanks for all the good information. I hope I helped. And just look out for me answering the questions after the live and everything. I will go back and answer your questions and put little information under them and stuff that you guys can read through and watch the replay, so you can watch the beginning to the end, how we got here, where we start getting all pumped up and everything. And last but not least, I'm just going to give you a take-home message and everything, and that is stroke is largely preventable, treatable, and a medical emergency. Make no mistake. The most impactful way to reduce your risk is to manage your blood pressure and make healthy lifestyle changes, such as quitting smoking, eating healthy, having a healthy diet, and regular exercise are some of the main things that can help turn a whole stroke around before you even see one. Know the symptoms. Be fast. Be fast and call emergency services immediately if you or someone you know shows any signs of a stroke. Prompt action is the most important factor for survival and long-term recovery. Make no mistake, be fast. And that would be one more time, just real quick. And then I'm going to leave you guys alone. B for balance. If you got loss of coordination, that's the telltale sign. E for blurry eyes or vision loss on one side or the other or both. F is for face, facial drooping, feeling like your face is melting and everything. A for arms, arm drifting. It won't stay up. It just has to go down. You know, it just won't stay up no matter what you do. It won't stay up. S for speech, slurred speech, almost like your tongue just blew up on you and none of the words come out. The speech is garbled or the speech is unrecognizable to somebody. You're saying what you're saying, but nobody can hear you because they don't know what you're saying. That's slurred speech. And time is of the essence. It's a 4-hour window for them to give you the clot buster for the ischemic attack. There are 3 main strokes that you can have. And one is ischemic. That's a dry stroke. That's a blood clot stopping the blood from getting where it needs to go. There's a hemorrhagic stroke. That's one where a vessel bursts and pours blood everywhere, drowning you. So that's a wet stroke. And then there's a TIA. And that is what they call a mini stroke. It resembles the ischemic dry stroke, but it sometimes resolves on its own. But that doesn't mean that you don't go to the hospital or to the doctor and tell on it and everything. And they do have a lot of work, and a lot of people I've seen recover 100%. And one was on the line today. Thank you, Auntie Josie, for your testimonial. Thank you, Maria, for your testimonial and everything. And just remember, we gotta pay and pay attention to these signs or we're not going to make it. Remember, be fast. All right. Thank you, guys. Everybody who participated, everybody that stayed on. If you couldn't stay on, understood and stuff, the information is out and it's out of me now and stuff. So you guys come on in, come back on when you get time and watch the replay. And Tony, thank you for coming on, and good night. You and my cousin Tank and stuff, my little sweet cousin and stuff. Y'all take care. I love everybody, and y'all take care and stuff. And remember, spotted, you might just save somebody by accident. All right, I'm leaving. An hour and a half. Too bad. Good night, Auntie Josie. Yes. All right.